Hey everyone, this is Mike Papuc with the Brokerage, your National Health Sales Director. And our guest for today is Breck Garrett here with Oscar. And today we're going to dive into some incredible stories in the ACA world right now, especially how Oscar is going to be set up to not just grow, but grow at a different way. They think about things a little different when it comes to the health market in general, right? So welcome to the show here, Breck. Give us a moment to talk about who you are and why are you here today?
Yeah, thank you, Mike. This is awesome. Thank you so much for having me. Like I mentioned, this is my first podcast, so
it is.
I'm thrilled to be able to do this here with you. My name is Breck Garrett. I live in Dallas, Texas, and I serve as the Texas leader for the state of Texas leader for Oscar. I've been with Oscar for almost a year and a half. Okay. But before that, have a lot of experience on both the carrier side, the health system side, and then also the primary care clinic side. So bring a wide array of experiences to Oscar, but Oscar's been phenomenal. Two things that are really exciting about Oscar recently, actually, is that we joined the Fortune 500 for the first time this year.
Congratulations.
I know, which is unbelievable. And then also we've grown membership dramatically this year. We now serve more than 2 million members across the entire country.
And where were you previously? So you're at 2 million now. Where were you previously?
2 million, prior year, end of year, I think we're around 1.7, 1.8.
So very good. So you're seeing some very positive growth in general.
Yes.
Just like talking to you and a few other great, fantastic people over at Oscar.
Thank you.
I mean, shoot, what are you guys looking to do as far as growth this year? It sounds like maybe 2.5.
Well, no, I mean, we're not throwing goals out there right now, but I will say, this has been a wild summer. So on the carrier side, when you think about positioning and pricing, it's been a roller coaster. And I know for the agents, it's probably been like even more of a severe roller coaster. And I'll give you one thing, one just kind of bullet point that's interesting is that over the summer, we hosted a lot of webinars for our agent partners, a lot of them actually around the regulatory uncertainty. And we hosted one this summer. It had the highest attendance of any webinar like in Oscar history. So there's a lot of, there's like a thirst for this knowledge and what's going on, and a ton of uncertainty. So when you look, I'm focused mostly on Texas, but it's true nationally. But you look and you see a lot of competitors who are leaving service areas, or they're curtailing commissions, they're pulling commissions back for whatever reason. One who, left the market entirely, right? Withdrew everywhere. I think at Oscar, you're going to see the exact opposite. You're seeing us double down on the individual market. We were born in the individual market. We grew up in the individual market. We're designed around this consumer-centric experience where the individual member is actually making the plan selection. And so you're going to see us continue to be aggressive, and we're really looking forward to 2026.
Hey, let's really hone in on that, because when you have a lot of carriers that are just backing off at a time of uncertainty for a lot of people, it's exciting to talk to partners like yourselves that are just like, well, what are we talking about? We're doubling down. We're ready to grow. We're ready to grow the right way as well, which I think is going to be a lot of value-based pieces. So we've been hearing that Oscar is planning to grow aggressively this year, right? So we're not going to put a number on that. That's perfectly fine, right?
Thank you. I appreciate that.
And I look at it from not just a regional perspective here in Texas, but even nationally as well. So you guys are poised to do some great things. What does that national growth look like in real terms? Are we talking new states, a deeper presence within Texas, or both? What are we looking at?
Yeah, I'd like to talk about maybe 4 things.
Sure.
So first, new states. So we're expanding our footprint. We're in 18 states today. 2026 will be in 20 states. So we're entering both Alabama and Mississippi. Do y'all have a presence there?
We sure do.
All right. I'd love to hear that. So excited about that. In Alabama, it's going to be mostly Huntsville and Birmingham.
Okay.
And then in Mississippi, it's Jackson and northern Mississippi.
Are these areas that you've been to yourself, or?
I don't manage the Mississippi and Alabama market. I've been there in the past, but not as part of this launch. But we do have a team who's been very busy on the ground, meeting with agents, meeting with providers, building the right network, doing it the right way.
Doing the right way. And that's what I love to hear. And that's what our partners, our agents love to hear as well. Every major carrier seems to have a strategy for open enrollment and even for SEP season. but when I think Oscar, I think a little bit differently. What's fueling the momentum in general?
Yeah, so I think when we look at the individual market, we see it's serving 24 million people today across the country. There's obviously a lot of regulatory uncertainty, but when we look at the individual market over the next 5 to 10 years, we think it has the opportunity to serve 100 million people. And so we're looking at it a little bit differently. Other people I know have their commercial line of business and they've kind of morphed it over to the individual business. We are laser focused on the individual business. So another thing that I would like to highlight is we are really building, I think, the building blocks for ICRA. I don't know how much you're talking about that with your agents.
We are, for the listeners out there,
Yes.
if you haven't heard any of the podcasts about ICRA or any of the trainings that we have surrounding that, you're missing out. We have them out there.
Awesome.
It's something that we have actually started really diving into as early as May. We went through, I would say, almost 24 interviews with TPAs.
No way.
Out there.
Okay. Yes. I saw some of that, some of the podcasts. Yes,
Yeah.
absolutely.
So the idea really, we want to make sure that agents remain independent. That's who we are as the brokerage, right? So we don't want agents to lose AOR. And we also wanted to make sure that the per employee per month was also reasonable with great tech. And the only one that we found that we were just very comfortable with, Ameriflex.
Really?
Yes. And they're based out of Dallas, but they also have a headquarters out in Cherry Hill, New Jersey as well. So just a little tidbit. So
Yeah,
yes,
we need to talk
we're
to them.
going into.
That's great. That's awesome. So we're thrilled about the opportunity there. We work with a variety of platform partners to help enable this. I think what's most innovative is that we've launched a new product and plan for 2026 in Iowa, partnering with Hy-Vee. Are you familiar with Hy-Vee?
Never heard of them.
So I'm not very familiar with them, but my understanding is if you live in Iowa and your listeners who live in Iowa, Hy-Vee is the coolest, best grocery chain in the upper Midwest.
Oh,
so think
like
of it as like the
here
HEB,
as well.
Publix
Okay.
kind of thing.
Yeah.
And they're an incredibly innovative, privately held company. They have their own like pharmacy benefit manager. They also run their own clinics. And so we've partnered with them. The clinics have like a subscription model where you pay an annual fee and you can have unlimited primary care visits. So we've partnered with them to co-develop a product for the ICRA market that relies on like the strength of our individual network, but layered on top of that is a free subscription to this Hy-Vee solution where our members then have access almost like in a concierge basis with these clinics throughout Iowa. We're looking to expand that relationship over time. Super exciting. Look at us to like build more of these kind of products. And then on the ICRA side, I think, look, it's a space where I think a lot of group employer brokers aren't very interested because it's different. It's not exactly what they've been doing. But if ICRA really takes off, like who knows the individual market the best? It's the independent agents who you guys work with.
That's correct.
And they're going to be best positioned to be able to capitalize on that and take advantage of it.
Right. And, with that comes a series of compliance pieces.
Yes.
That goes into it and a little bit of the know-how of not just understanding the individual space, which is perfectly fine because it is the individual market, but also I call it like a hybrid because you still have to have that census. Something that goes into place to make sure. So it's definitely like a hybrid model in general, but it's also very exciting. I know states like Ohio, for example, are really growing in the ICRA market altogether.
Yeah.
When you have group rates that it's coming out to $2,000 per employee, right? When it comes to the group, and then you have individual rates that might be in the $500 range, to me, it's a no-brainer to just, hey, you know what? Let's save money. Let's add more benefits to the employee.
Yep.
And honestly, at the end of the day, you have the choice of which plan you want to choose when it's all said and done.
Absolutely.
So it's great to hear that. I've always recognized Oscar as one of the founding carrier partners that is really taking the lead and charge when it comes to ICRA.
Yeah, you'll continue to hear a lot from us about this. And I'm so excited that you're educating your agent partners on this as well.
Well, thank you.
Yeah.
I mean, that's what we're here for.
Yeah. No, that's awesome. That is awesome.
Now, from a big picture perspective, how does Oscar plan to stand out on what's becoming a really competitive ACA landscape?
Yeah, so I think a few ways. I mean, I mentioned a little bit, we're expanding our footprint, so we'll be in 20 states. We're also expanding the number of markets that we're in. So we're in 20 additional markets. So we'll be in Dayton, Ohio. You mentioned Ohio earlier, Western Tennessee, some other markets, and we'll be, deepening our presence within some of our existing footprint. So I think, one way that we're differentiating ourselves, other folks may be kind of trimming their footprint on the individual side. We're expanding.
Yep.
And then we also have some personalized plans. So plans specific for people's health conditions. We've rolled these out previously. We have a plan for diabetics. We have a plan for those who have COPD, those with multiple chronic conditions, but we're rolling out more and more of those.
And I'm excited to hear that. And one of the things that I love is, what can we do to think outside the box? We know that consumers are dealt with all sorts of different types of risks, whether if it's kind of like diabetes or COPD, or maybe just for example, like, you don't expect things to happen, such as cancer, heart attack, or stroke. Even the more critical pieces there. Innovation and product design to me is what can actually help to separate others when you're in a world of competition between yourself or maybe another carrier that's out there.
Yep.
So let's talk about that, right?
Yeah,
because
absolutely.
To me, it's exciting to know you guys have all the ingredients from service, the portal. Innovation and product design to me is kind of like a cool differentiator. So you guys have been very tech driven and member focused, making healthcare simple and personal. How are you continuing that innovation for 2025?
Yeah, so we think of ourselves almost as a tech company first and foremost. So one thing that's very cool and differentiating is that we're really the only health insurance company that's like a full stack health insurance company. So what that means is that we control and build kind of the front end, the member facing portion of our experience, and the back end, the back office piece. But one thing that's really cool to talk about on the tech side is that we've partnered with OpenAI, and we have launched our first member-facing AI agent. We call it Oswell. So think like Oscar Well, Oswell. It's available for members on the app 24/7, as you can imagine. AI agent.
I can download this app right now.
You should check it out.
Oh my gosh!
You should check it out, and it can actually ingest. So one, obviously your plan information. Two, some of your medical records actually. And offer actionable guidance. So things that you can use Oswell for. One good example is cost estimates. This is like notoriously difficult, almost impossible to figure out. Finding in-network care, Oswell can help with that. Helping our members refill their prescriptions, Oswell can do that.
But you're still talking to this AI-based software that knows everything about your specific plan that was selected, and then you ask it key questions, and then within seconds, you're receiving a response.
It's fast. Yes.
How fast?
I don't know exactly, but it is. I'll tell you, it's fast. It's like in real time.
See, now that's fast.
The other thing that's cool about it is that it can, if needed, it can connect you immediately with a $0 virtual care appointment with our clinicians, which we offer on our platform as well.
Really?
Yeah. So it's super cool. Think of it as like a doctor in your pocket.
I've heard that phrase before, but I feel like now for the very first time, that's actually true. That doctor, that concierge in your pocket. I use like MD Live for myself, or I even use Teladoc when I was back in Pennsylvania. And that brought me at least some sort of, hey, you know what? It's the middle of the night, and I don't have to worry about 3 a.m. taking my kids to the emergency room because the urgent care facility is closed. Let's see what's going on, and maybe from there,
exactly.
I don't have to worry about paying $3,000 just to go to the emergency.
Yeah.
But that is just amazing. I mean, you're the first to share this.
It's very cool, and I think you'll see more and more innovation like this from Oscar in the years to come.
I mean, yeah, with a backup from a tech perspective, I think you guys have all the ability in the world to really continue to lead that side as well.
Absolutely.
Hey, and you know what? Before I go on to the next question,
I
mean, any cool things down the future that you guys are talking about?
I think I'm going to keep the cards close to the vest on that one, actually. But you will see more, I promise you.
Got it. I can only imagine like what just if that is the beginning, already my mind's racing towards the other possibilities as well.
Huge opportunity. Yes.
Very good. So let's talk about some other groundbreaking things. Okay. I think this was more centered around women's health.
Yes.
Tell us more about that. What specific features, benefits are being introduced around women's health?
Yes. So I mentioned our personalized plans earlier. So plans that are built specifically for our members who have certain health conditions. And so we had a roadmap for that. And one thing that was always on the roadmap was women's health.
Yeah.
And I wasn't entirely familiar with this, but according to some of the research out there, there are 50 million women going through menopause.
Okay.
And then this was a shocking stat to me, is that 1 out of 5 women who have gone through menopause considered leaving the workforce.
1 out of 5.
Yeah.
20% is a very high number.
Yeah. So it's not just like a health issue. It's honestly like an economic issue. It's a public policy issue, all these issues. And there's never been a individual plan that's built something customized for this audience.
Yeah.
And so we have built a plan. It's called Hello Meno. It's, I think, the first of its kind. And it offers our members who enroll in that plan $0 gynecology visits, $0 primary care visits, $0 behavioral health, no cost bone density scans. So it's catered exactly for what the population needs. We've also partnered with a national telemedicine vendor called Electra Health that is, again, just guided to work with this community and individuals going through navigating midlife, really. And that platform is available 24/7, has clinicians on the platform, so our members can access that through the Hello Meno product. We also offer rewards for certain like health visits and things that you do throughout the plan. And we calculate, like at the end of the year, a member who's going through menopause can save $900 just on the plan design elements.
Really?
Yeah. So like we've continued to, I think, kind of push the envelope, lead the industry in this space. We're excited about doing this in a space that's underserved.
So new agent, new to Oscar, they go to Health Sherpa, for example. How will they know that this would be the specific plan that they can identify and utilize for their clients?
Yeah, I think honestly looking for the plan name. And the plan name is Hello Meno. Hello, MENO.
Perfect.
Offered via Oscar, yeah. But I will say, like, the one thing that I'd really encourage from your agents, and the support that we could use from your agents, is think about the sale with a potential client more along value throughout the entire year. Mm-hmm. So like, let's say, this plan may cost in premium, let's say, I'm throwing numbers out there, but let's say it costs $20 more a month in premium. When you think about the value that member's going to get throughout the year, like it's going to more than make up for the premium difference. But just don't shop entirely on the premium is what I would just encourage. And think through these plans for all of your clients, because like they're differentiated. And I think it helps the agents be seen more as like a consultant than a transactional process.
And I completely agree with that, especially as ACA transitions back to a non-$0
Absolutely.
mindset.
No, you're totally right. Exactly right. That's exactly it.
So I would say to the listeners out there, let's make sure that we have our cheat sheets, right?
Yes. Yeah.
Carrier A offers X, Y, Z. Oscar, Carrier B offers A, B, and C. So that way in your given area, if you have a client that has a specific needs, which, by the way, conduct a needs analysis, right?
Yep. Yeah.
So that way that this plan is going to actually be built that is tailored to their needs, for both benefits and budget in mind as well.
Yep.
Because you'd be surprised to know like how sometimes people chase the zero, but even if it's that $20 or $30 plan that gives them exactly what they're looking for, people are more open to the idea of value if it's truly tailored to them.
Yes. Yeah. Perfect. Exactly right.
So when we look at all these changes, how do they fit into Oscar's overall mission of improving accessibility and quality of care for their members?
Yeah, I think look, our goal, we want to serve more people in the individual market. We want to continue the growth that we've had. And we want to make sure that we're serving like all these individual pockets of the market. And that's why we're developing these new plans. members who are in these plans, we get really good feedback because the plan really like encourages you to use the plan. I know, like shocking idea, but yeah, exactly. But to use the benefits, because a lot of the benefits that matter to those who are enrolled in these plans are $0. So I think that's a big way that we see ourselves serving the community, delivering better quality outcomes for those in our products.
Very good. So let's talk about partnering with agents. We know here at the brokerage, the one thing that we've relied on for the last 50 years, service.
Yep.
What are we doing to empower our partners so that way they're going out there and imparting wisdom to others, right? So we have a wonderful library of ways to help people grow, get educated about ACA, all sorts of products, both in English, Spanish. We have an entire library for the BrokerLink 2.0. So we know when it comes down to training and working with Oscar, partnering up in ways to make sure that we keep them in the know about what's going on in the industry, both from an Oscar perspective, but also from a legislative perspective as well, especially in a year right now where it's just what's happening, right? But let's talk about some of the things that we were talking about earlier. Are there any additional incentives or marketing programs or marketing materials that agents have access to in your broker portal?
So we hear phenomenal feedback on our broker portal. We hear it's really easy. We hear like everywhere I go, whenever I get in front of agents, I hear like great feedback on the portal. The team has done a nice job of enhancing it, actually. So we've got some new things in the portal for 2026. So I hope they're well received, but I can give you a quick preview. So the first thing that agents will be able to see in the portal is they'll be able to see the members who we think are most at risk for leaving the market.
Okay.
And so they can kind of prioritize their time when they see that. Something else that we'll be able to demonstrate is those members who will get the highest increase again, so that like the agent can spend more time with those folks and really guide them for the best solution.
How do you know? So are these based off of, are the enhanced subsidies going to stay or go? What's the logic there?
So the logic, varies based on sort of what we see what happens. So, but I know that our tech team is capable of developing that out, depending on what exactly happens.
Like an on-off switch.
Yes,
okay,
absolutely.
Got it. So right now the logic's just so that the agents know
when
they go.
Yes, good question. So the logic right now, I mean, assuming that the extended subsidies would go away.
Got it. Yeah, because it is slated to go away unless Congress enacts some sort of a extension or a continuing resolution of sorts.
Yes.
Okay. Very good. So we talked about the portal, the access, the tech. You guys are really ahead of yourselves. It's one thing to sell, right, and to say, here is this wonderful plan with Oscar, right, and some of these might be disease specific or life specific. Things that are tailored to what the needs are. But that's just one phase of it.
Yeah.
Right? You want to make sure that your member experience and your retention around that is really at the highest level possible. Just out of curiosity, what do you guys average as far as member retention? Do you guys know, like, is it like a 2-3 year piece, or is it higher? Is it lower? Do you know your averages?
Yeah, we do. So it varies market by market. But I will say we tend to overperform the industry. The two measures that we really focus on and report out is we look at our current members and how many would really recommend us to their family and friends. So 3 out of 5 of our members would recommend us to our family and friends. When we ask why, it's because they say when they're at Oscar, they feel like they're treated like a family or friend would treat them.
Oh, very
good.
We
love that. The other measure that we are actually like laser focused on is our net promoter score. So if you're not familiar with this score or measure, it really subtracts anyone who like does not recommend you or actively recommends against you from those who recommend you and gives you a score. And so our score is in the low 60s.
Okay.
So to benchmark that, like consumer first technology companies like Amazon or Airbnb, they're in the 70s. So that's who we're benchmarking ourselves towards. And if you look at some other folks in the industry, there are people in like the teens, even zero, really. And so we're benchmarking ourselves again to like consumer focused industries. I think we've seen our retention, do better than the industry as a result of that focus. But I think what it means to an agent is that like an agent should know if they're working with Oscar, their client is going to has a high likelihood of having a positive experience because 60% are recommending us, and that it can be a long-term relationship. That member can be happy in an Oscar plan for a long period of time.
And do you feel that the part of the attribution is also because of the plan designs? I mean, what would you say is kind of like really driving that really high-end retention that everyone's talking about?
Yeah, well, I mean, as you know, price seems to be king in the ACA market, but we have found that the member experience is valued so much that when price is close or in the ballpark, we can still be really competitive on a year-over-year basis. So to me, that indicates that our members are really appreciating the tech and the consumer tools that we've developed.
Right. I remember as a former agent myself before ACA started, I would say, hey, you know what? I see that your Blue Cross plan here in Pennsylvania is going up another $100. I could take care of that for you. I could actually save you money, give you better benefits in general, so you have a lower deductible and out of pocket. And they would always come back to me like, why would I do that? I have Blue Cross.
Oh, wow. Yeah. That's great.
So it's one of those things where it's just like, over time, when you're building that name and brand recognition of trust, and making sure that everything is curated to that consumer experience, I could see how retention is going to continue to be a continual kind of like upslope for you guys.
That's the hope. Yeah,
it is.
One other thing that I neglected to mention that I do want to mention on our broker portal. Sure. So I mentioned the public bonus. The other thing that we're rolling out, which is very cool, is that agents will be able to go into our broker portal and track how they're performing against the bonus target in real time throughout OE.
That's fantastic.
So provide like this level of transparency and honesty to our agents, which is something else that we're really excited about.
And you really don't know until, so that's actually that's great to hear that you guys are going through that transparent piece. You don't hear that a lot.
Good.
Hey, so for the listeners out there, when do they get paid? So let's say, for example, we're going through open enrollment. Is this something that is a April, May, June kind of payout when it comes to the agent bonuses?
I would want to be very specific on that and get you the right answer, so I can get you get that to you.
Absolutely.
After the podcast.
Yeah.
I don't know specifically. I would not want to share the wrong information.
You're getting
yeah, exactly. Do not want to run into that situation.
That's the last thing we want to do. But just the fact that you guys are offering that information in real time is head and shoulders above everyone else.
Good.
So we're talking about service with the member experience, retention. Let's dig in a little bit there, right? Do you have any powerful member stories that you can potentially share here that actually goes towards, so that way it shares to the agent community, wow, I should consider Oscar because it goes above and beyond for X reason? Yeah,
I think in addition to the things that sort of I've shared earlier, we do get just phenomenal feedback on the condition specific plans. And it's like a different relationship, I think, that those members have with us than they've probably had with any insurance company in the past. And again, I think it's something that your agents should feel very comfortable, very confident about placing their clients in. We do a lot of, I'm sure you guys do too, we do a lot of community engagement events throughout Texas. And I love those. I love hearing directly from our members and hearing just, incredible feedback on the tools, the experience they've had with Oscar, how they recommend it to their family. So hopefully your agents feel that through the experiences they've already had with Oscar.
And honestly, for everyone listening, reach out to us, share those experiences. We love to hear stories and to make sure, and not just the positive experiences, but let's hear all the experiences in general, because the one thing I know about Oscar is the fact that they want to listen, they want to grow, and they want to continue to innovate towards what they can do towards helping their consumers out in general.
Yeah, we love feedback. On top of that, like if you're looking at an Oscar plan and there's a physician or provider who's missing, like please let us know. Like that's the kind of feedback we love to hear from our agents because we can make our products better.
Very good. So for agents who want to grow their ACA book this year, right, as we head into open enrollment, what's one strategy you'd recommend that they focus in on? How do they win?
It's gonna be a wild open enrollment just with everything going on, all the uncertainty. I would say that there's still a ton of opportunity out there. So I mentioned doing these events. We run into so many people who I think are eligible for subsidies, eligible to be on the ACA, eligible for coverage, and they don't have coverage for some reason. And so I think these individual members, they're going to be a little bit harder to reach this year than maybe in prior years. But the opportunity for agents, I think is still incredible. That's why we're so bullish and optimistic on the individual market. That's why we're expanding into all these new markets and new states, because the opportunity is just unbelievable. And so we're so happy to be able to partner with people like you and the agents who are listening to this. Because honestly, they're the ones who are out there in front of our members directly. They're the ones who are getting people health access and coverage that they may have never had in the past. And I think from my point of view, they're doing an incredibly honorable thing and helping us out. So we're so grateful for them and everything that they do.
Wonderful. So as we head into the final part of our segment, right, let's talk about Oscar, right? So we're going from an agent perspective and clients alike. When you go into open enrollment and you tell them you need to think about Oscar because of X, what would it be?
I think you have to go back to the member experience and how it's so differentiated, I think, from the competition. So yes, I mean, like price has to be relevant. On a market by market basis, you'll see probably different results for all the different carriers. But I would think as long as, if we're in the ballpark, I think you should definitely look at Oscar and consider the opportunity that you have on the agent side to build this longstanding relationship. The confidence you'd have that the experience is going to be differentiated, that your client's going to have access to these tools that haven't been developed by other carriers and other competitors, and just feel really, really good about that decision.
And that's great advice and great feedback. Breck, I want to thank you for the conversation today, man. I love really talking about how Oscar is continuing to just like create the tech. Even with that little, what was it called again? Oswell?
Oswell, yeah.
I can't wait to download that and actually use it maybe one of these days. Oswell, that is going to be wonderful. I love to hear that you guys are innovating plan designs, especially for women's health. It's a very key part of as we continue to evolve in this space altogether. So thank you for your time. Thank you for a great conversation.
This was a blast. Thank you so much. Thank you so much. I appreciate it.